we are talking products that you can use in your office for pubic bone pain. So when your patients are coming in with that lightning crotch, their pubic bone is pulling, they are really uncomfortable in that area, we got to make sure that we loosen off the adductor muscles, as well as provide them security or stationary things to help them with the comfort when they're at home doing their daily tasks, whether that's walking around, whether that's doing house chores, whether that's chasing a toddler all over the place. And so when your patient is coming in with pubic bone pain, make sure to instruct them to always try to do everything in unison. So make sure that they are doing double-legged squats, that they're not doing big lunges, because that shearing force that they do on their pelvis can be really irritating for that pubic bone. And so that being said, make sure that they are basically trying to keep everything nice and snug. And when you're doing your adjusting, using a drop piece or an activator. Drop piece tends to be a lot better for patients because it's less spicy than the activator, so just keep that in mind. But for products specifically, we are going to use our strengthening tool, our Pilates ball first. And so I'm just going to sit on this exercise ball here that we have in the office, but if you don't have one of these, you need to get one, but two, sit on just a normal chair. So what I'm going to do with my Pilates ball here is you're going to place it in between your knees. You're going to instruct your patient to squeeze in, hold for about 5 to 10 seconds, and just do a continuous squeeze. This will help strengthen those adductor muscles and pull the pubic bone in unison and make it more even for them. And so when you guys are doing this, if you don't have a Pilates ball at home, you can instruct your patient just to squeeze their fists. This can be a little bit tender depending on how tight that musculature is. And so having the Pilates ball is really beautiful to show your patients how to use it at home. And it's also just really nice for other exercises that you can use. When you're doing adductor stripping in your office, make sure that you have a muscle stick, or you can use hot stones in your office. We love using our hot stones for this area because it can be pretty tender, it can be ticklish for some patients, but the muscle stick provides that relief for them without getting super in depth with pressure. And so when you guys are doing this, I'm going to go down onto the floor here. So you're going to have your patient on the wedge, right? And then have their leg out to the side. And then you're going to strip down their leg. This is going to provide that muscle relief that they need for that pubic bone, because sometimes when that pubic bone is shearing, it can be that one side's tighter than the other, and of course we want to make sure that both are nice and loose for your patient. The third product that we're going to go over is our handy dandy SI belt. And so what this is doing is it provides that relief and secures everything nice and tight for their pelvic girdle. And so just make sure when you're using this, you're going to go nice and low on that tailbone here, right center. It's helpful if you put it on the patient before they try to do this at home. Cinch it up nice and tight. And then take these little handy wings here, and then they can grab them both, cinch it up nice and tight in unison together. If this is not enough for your patients, we do have belts on our Amazon storefront that have that extra band that comes and tucks underneath the pubic bone, because sometimes with that pubic bone, they might only be feeling it right on that right side. And so having that extra band that comes through can be really nice to really cinch down on that side and let the left one go nice and loose. And so depending on what your patient's going for, the belt can make a huge difference to them and provide that relief that they're looking for. For more information, check out our other product videos with different symptoms that your patients may be going through. But of course, subscribe to our YouTube channel for more.